Your genes hold the answers to your family's overall health. I'm Dr. Paula Krupstad, and on the Get to the Root with Hope for Healing podcast, I sit down with experts in genetics, functional medicine, and family care to explore what's really going on beneath the surface so you can stop guessing and start healing. From personalized insights to practical tools, we bring you whole family wellness that starts at the root. Welcome to the Get to the Root podcast. And on today's podcast, I'm grateful to have Tran. She's the owner and operator of Roberds Pharmacy, which is a regular insurance-based pharmacy and a compounding pharmacy in the Conroe, Texas area. Welcome, Van.
Thank you, Dr. K, for inviting me to the podcast.
So I wanted to be able to educate our audience a little bit about what a compounding pharmacy is. And also, too, I think that your credentials are outstanding and they really serve our patient population well. First of all, not only are you a PharmD, and could you just let the listeners understand what that is, apart from just a regular pharmacist?
Sure. So PharmD stands for Doctor of Pharmacy. So a while back, pharmacy school, before they implement the degree of Doctor of Pharmacy, they have registered pharmacists. So that's shortened as RPH. So RPH and PharmD go through the same pre-pharmacy courses and they go through the same rigorous pharmacy school program. However, registered pharmacist stops at 3 years of pharmacy school. PharmD goes through that extra 1 year of clinical rotations where we do a lot of clinical setting, where we are an integral part of a patient health team to help come up with, treatment plans for the patient. So I feel that 1 year clinical setting really helped, me in this setting as a compounding pharmacist today.
Okay. Great. Another question I had for you is, can you let everyone know what a compounding pharmacy is?
So compounding pharmacists, work at a compounding pharmacy and we do customized medications for an individual patient that manufacturer or commercial products, drugs do not meet their needs. For example, if a patient wants a cleaner product, we can compound the capsule form, like oral capsule form, and make it dye-free, gluten-free, preservative-free. And then if the child needs a liquid, we can make it sugar-free, dyes-free. We can flavor it according to what flavor they like. And then obviously preservative-free, dairy-free, nut-free, all of that to make it into a cleaner product. Or if there's not a commercially product available in a certain strength, we can compound it into meeting whatever the strength that they need or the dosage that they need. And also, compounding pharmacists, what we do is medication review. We work with the team to come up with a treatment plan for the patient, and we do it we collaborate with the providers to come up with the treatment plan. So compounding pharmacists do collaborate a lot with the provider and the patient as a triad relationship, and so I love it.
Very grateful for pharmacists because there have been times in my career where I have recommended something and the pharmacist would give me a call back and say, "Oh, by the way, this patient is on this medication and that interacts with this medication." And so that accountability and, like you said, collaboration is very, very helpful. So in the last year, the other thing I think that is so unique about you is that you are certified through the American Academy of Anti-Aging Medicine and also through the Institute for Functional Medicine. And those additional certifications give you the framework from a functional medicine standpoint on working with patients to just understand the processes and the reasoning behind why functional medicine providers do things a certain way. So I'm exceedingly grateful for that on a daily basis when we work together.
That's right.
All
Thank
right.
you. Yeah.
So I wanted to take a little bit of time. There's been a lot in the news over the last year about leucovorin, and leucovorin's been around for a really long time. So if you were explaining to someone who knew nothing about leucovorin, what would you tell them?
Sure. So leucovorin is known as folinic acid. So it is a bioactive form of folate. It bypassed many conversion steps, not like the ordinary folic acid. It bypassed many conversion steps to give that folate for the body to use. So if I'm explaining it to a mom or a parent regarding folate, I just say your child's brain is fueled by folate. And so if there is a deficient in folate, they may not be able to do the regular central nervous system communication like, a regular child. Oh, I'm sorry. My headset keep falling off. And and so the folate, when it does, it builds neurotransmitters and it support myelination in the central nervous system. So and leucovorin is FDA approved for a condition called cerebral folate deficiency, ACFD. And what it does is, in theory, autistic kids tend to have issue with not having enough folate in the brain. Where CFD, you don't have enough folate in the brain, but you have normal blood folate. So that's the condition that leucovorin is FDA approved to be dispensed for. Now, there's also another condition that is called threat folate receptor alpha autoantibodies. And so you go through that test, and if the patient tests positive, that means leucovorin is going to be very beneficial for them because these are there are antibodies at the folate receptor in the brain that will not allow the folate to be utilized in the brain. So if the patient is test positive, there's a lot of clinical studies that and also randomized trials that say leucovorin is going to be very very substantially beneficial for these patients. So I kind of, give them an idea of what that does. And you see great improvements in attention, cognition, and then also language and also behavioral responsiveness. In clinical setting, I talk a lot of parents that after they start taking the leucovorin, either liquid or capsule, just within a week, they can see a great difference. I presented to you a case of a mom that texted me, and she said, Van, oh my God, on Mother's Day, my child came to me and started speaking, and he was nonverbal previously. And I was so amazed. And she said it's because she got on our leucovorin that she noticed a great difference. And the father was just amazed as well. Father's Day, this should be a Father's Day gift for me as well. But he started to express himself, to them that he wants this and that. And then hopefully in the next few months, I can hopefully, to hear from you. They're going to visit you again in a few months, and hopefully they're going to be more and more improvements from that.
Yes. What's so remarkable specifically about this particular little patient is that he had been prescribed leucovorin from a regular pharmacy. And I believe that they were taking a tablet and crushing it and mixing it with water, and they did not receive any of the benefits. And when they started using the leucovorin that you made into the liquid for this child, it was absolutely 180 degrees from the way he had been behaving. And, observing this kiddo in the exam room, it was as if he just couldn't speak. He was blocked, but he was listening and comprehending what we were doing, but he could not get those words out. So now what does the acronym PCCA stand for?
It stands for Professional Center Compound America. And so they are based in Wilcrest Drive in Texas, and we're very fortunate to have them in, our background, our home here. They've been around for a long time, and they're a company that does, API active pharmaceutical ingredients, and they also created their own bases. And they've been around for a long time as consultants for compounding pharmacists. And they were in the first wholesaler around when compounding field actually started.
Yes, the ingredients are extremely pure, and that has been so very, very helpful. Okay, so leucovorin, basically vitamin B9, a bioavailable form, folinic acid. And it's very interesting what you were talking about, the frat testing, where you can have binding proteins or blocking antibodies to those folate receptors in the central nervous system. There's a difference between using something called 5-methyl tetrahydrofolate versus folinic acid. And if a body is still very, very inflamed, if you try using 5-methyl tetrahydrofolate, you'll see a lot of anxiety. So that's where you hear people say, well, I can't handle methylation. I'm over methylated. And what my clue is there's still a fire in this body and we have to dampen it. And so the advantage of the leucovorin is it doesn't do what 5-methyl tetrahydrofolate does. If the body's inflamed, you don't get that kind of a response. So just a little dab will do ya. And then, you know, slowly increasing it to see how someone does. So thank you for making those clean alternatives. And you can make liquid, like you said, a capsule. What about like a chewable tablet also?
So there's no studies on a chewable tablet yet. And then also as well as troche, you don't want to expose glucagon to heat. So PCCA has tried to done a formulation where it's a chewable and it involves like a troche you put in the mouth to dissolve in the buccal mucosa. And they said that the potency that came out is not as great. So they decided not to put in the formulation. Now going back to that mom that you mentioned about getting the tablet and they crush it and make it into a liquid form. I see two problems with that. Number one is the tablet does have lactose, gluten, and some generic company may have dyes in it. So I don't recommend taking the tablets and make it into the liquid for the kid for leucovorin compound. Also, some places may use a water soluble formulation to make the leucovorin into the liquid. And I don't recommend that either because leucovorin is deactivated in water after about 7 to 10 days. And a lot of these patients are on it for at least 30 days for the prescription. And so it may not work as well. So what we do is we use an anhydrous suspended phase from PCCA. They just recently made it, I think within a year or so, and we use it to make leucovorin, and you can make the dating all the way to 3 months because there's no water substance in there. So the leucovorin is very stable in that anhydrous suspended phase. So there's a
Well,
difference in the formulation when the kids use
yeah.
it. Mhm.
Yeah. Well, I just learned from you about the longevity of this anhydrous base. So that's an excellent tool in our arsenal to have. All
And
right.
also, one
So,
more thing, the anhydrous suspended is preservative free and it's sugar free. And they use, I think the sweetener they use is monk fruit. And then they also free of dairy, nuts, and all that stuff. I've looked it up just to make sure it is good for our patients. Yeah.
yeah, so the big deal about gluten and dairy is both gluten and dairy make gluten or gliadin makes gliadorphin. Casein, which is in dairy, makes casomorphin. And those are short chain opioids. And indirectly, through a series of steps, not only do they bind to opioid receptors, and that's addictive, that and the food industry knows it, but also they bind to the cerebral folate receptors and block the ability of the B9 to bind to those cerebral folate receptors. And we check blood for this, and you'll see one of two things. You'll see greater than 20 of folate in the bloodstream, but the patient is not on any folate in any form whatsoever. And it just means that it can't get into the cell. It's in the blood. Or we'll see it incredibly low, like 2 or 3. And that means they're so globally defeated of folate. No wonder they feel so poorly. So we try to give the leucovorin or these forms of vitamin B9 twice a day so that there's a consistent production of dopamine. And dopamine is just this beautiful balancing neurotransmitter between the excitatory neurotransmitters and the calming neurotransmitters, but also it just drives so many processes in the body. And specifically, as you said, when we place a child on leucovorin, many times we'll see improvement in language, improvement in presence, a decrease in their stimming and repetitive behaviors because you're giving them the folate to make the dopamine and they don't have to do things to create that dopamine fix. So I just love it. I just love it. So
Yes, that's awesome.
I feel bad when, when people say, can't this just go to a regular pharmacy? And I use all the same arguments to just say, no, it's not clean. You're not going to get the effect that you would be getting unless you have this beautiful, clean formulation to fuel the brain and the body. So, all right. Well, another thing I wanted to bring up now, you're here in Texas. And so Van can provide through Roberds Pharmacy throughout the state of Texas, or if the patient flies in and if they're still in town, we'll have them go up to Roberds to get their products before they leave the state. And so she takes care of everyone that's here in Texas. Now, another compounded formula that we find incredibly helpful is Synapsin. And I'm just going to pause because everything we do here at Hope for Healing is traditionally based on what the patient's unique genetic footprint is. So we use something called the Hope for Healing Wellness Blueprint. It's a proprietary genetic panel that Fagron Genomics has allowed us to make. And everyone's genetics are unique. If you have 2 or 3 children from the same set of parents, it's kind of the luck of the draw. You've got 4 different choices from each parent. So you can have a lot of variability among siblings. So SYN1 is a genetic marker that codes for some enzymes that help with the ability to create new synapses within the brain and also with what we call synaptogenesis, brain growth. And also there's these cells in the brain called microglia, and it helps them they're like little Pac-Men, and they help clean up the brain. So there's a patented ingredient within it, but can you kind of go over what's within Synapsin? And I'd also love it if you teach our listening audience from the perspective of you as a pharmacist explaining what Synapsin does.
Sure. So it's a great product. Synapsin actually was discovered back in the 1970s at Yale University. It was first found there. Not until years later, a compounding pharmacist called Jim Laval, he patented Synapsin, and contains a few ingredients in there, including RG3, which is ginsenosine. It is derived from Panax ginseng, so it has a neuroprotective and anti-inflammatory effect in laboratory. And so they use that to hopefully help with the brain function and the synapses. And then the second ingredient is nicotinamide riboside. So that is an NAD plus precursor, and it is a B3 derivative. So NAD plus is the oxidized form of NAD, and what it does is it helps with cellular energy production. And not only that, it supports DNA repair, DNA repair, and it also help with mitochondrial dysfunction. It helps to with the neuroplasticity, which means that it's the brain's ability to form and strengthen connection of the neurons. So it's not so much of the brain grow larger or we form new region of the brain, but all it does is it helps to protect, decrease down the neural inflammation. It supports the brain function, it helps with mitochondrial and the energy. Also, compounding pharmacists put B12 in it, and we like to ask the provider to write it, the synapsin, with methylated or hydroxylated B12 because the FDA considers synapsin as an inactive drug. So they won't let the providers prescribe it alone. So we have to add it with B12. But it's good because B12 helps with methylation and also with nerve function. So we usually ask a provider to prescribe a zero point 0.5 to 1 milligram per ml with the synapsin, 5 or 10%, and make it as a nasal spray or an oral suspension. But we love it. I mean, it protects the brain, it helps with cognition. Also, in adults, it helps with memory. You see kids having better attention and energy in general. So synapsin is a good product, one of the best one that we compound for autistic kids.
Yes. I think initially when Dr. Lavali, Jim Laval, or I don't know if it's Laval or Lavali, when he
Laval.
patented that, Laval, it was used for traumatic brain injury and concussions, and not that deficiency of SIN1, but it's just absolutely phenomenal. So as you said, neuroprotective, neuroinflammation, and helps the mitochondria, which are the batteries or the powerhouses of the cells, make ATP or energy. So what I've seen directly is what parents tell me is that their children are able to engage in critical thinking when they've received synapsin. And so, for example, a young man brought out he was autistic, he is autistic, and he brought a toothbrush and a tube of toothpaste. And he got his mom's attention and he said, "Mom, I want you to go to the store and get more of this." And he pointed to the toothpaste, "so that I can do this, brush his teeth." And the connections, she hadn't seen that. So those little victories are fun things to share. I've also just seen more spontaneous language, spontaneous language, more vocabulary. So much of the time when we think about people that have neurodevelopmental challenges, it's as if they're in there and they need to be unlocked. And I just see synapsin and leucovorin as just amazing, great tools to do that. I appreciate your explanation as a compounding pharmacist. And one other thing I thought that we could talk about just very briefly is amantadine. Amantadine is a plant-derived drug that I think came to market back in the 1960s, and initially it was for influenza A. And I'm just going to let you talk about how you see amantadine used, and then we can talk a little bit about some other ways that we like to see it used, or just as another tool in the toolbox to help with focus and concentration and calmness. So I'd love to hear what you have to say about amantadine, Band.
Sure.
I'd like to thank Fagron Genomics for sponsoring our podcast. Without knowing what your precision genetics are, you don't have a roadmap. So please log on to our website, schedule a welcome call, and see what the Wellness Blueprint can do for you. That's the premier and proprietary genetic panel that Fagron has allowed us to create.
So amantadine, like you say, it was actually developed at first as an antiviral, and then it's also being used for Parkinson's disease as well as drug-induced movement disorders. But it's off-label use for autism. Now, a lot of clinicians use that for impulsivity for patients, and kids that have a lot of hyperactivity, impulsivity. What it does is it increases the dopamine activity in the brain. It works on the neurotransmitters as well. And besides that, it does glutamate signaling via the NMDA receptor antagonist. So it has several mechanism of actions, but it's off-label use in autism. There's not a lot of clinical studies, but there was a big one back in 2001, I believe, that they did it for autistic kids, and they see improvement in speech and decreasing in hyperactivity in these patients. So a lot of functional medicine practitioners out there use amantadine as an add-on for kids, especially if they have a lot of impulsive, acts as well as behavioral aggressiveness and things like that. And it does help, calm them down. Yep.
Yeah.
Now,
Yeah.
one thing you may want to also look at is it does renally excrete it and metabolize 80 to 90%. So we need to make sure that we titrate the dose up. We also look at the renal function before putting the patients on amantadine, and also do a titration schedule to slowly increase based on their sleep pattern, their cognition over time, and their behavior.
Yeah, that explanation is very good. I think that our colleagues in the mental health world, I think a lot of psychiatrists use this as another tool in the arsenal too. But if we find on our genetic panel that a child or an adult has something called GAD1, glutamic acid decarboxylase 1, it's like you said, there's that receptor called the NMDA receptor. And there's excitatory neurotransmitters and there's calming neurotransmitters. And glutamate is one of those excitatory neurotransmitters. And it spikes through the roof when you have head injuries, traumatic brain injuries, concussions, things like that. And a lot of times in the functional medicine world, you'll hear people for a leaky gut, they'll just say, use L-glutamine. Well, a lot of times that will make people incredibly anxious. And it's a tool, but for people who have GAD1, you don't want to give it to them. Same with their maybe an amino acid supplement. If it has a lot of L-glutamine, it will make them crazy. But what I hear, and we do a lot of titration, is we start at a low dose and we have parents give about 25 milligrams twice a day and then do that for 3 days and then go up to 50 milligrams twice a day, do that for 3 days and keep going up. And typically the max that we use is about 100 milligrams twice a day. But I've heard people say, and this includes individuals who are neurotypical, but they struggle with inattentiveness. And even my children told me she was doing dual credit for high school and college. And she said, Mom, when I take 100 milligrams, I feel like a zombie. But when I take 50 milligrams, I can focus, I can concentrate, I can get all my work done. I feel great. I can wrap it up. So it's just like you said, there's that sweet spot. And hormesis is
Mhm.
the word that we use. It's like the Goldilocks effect. We don't want too little. We don't want too much. We want it to be just right. And I think with a lot of our medications or compounded things, that's something that we see. So I have heard literally within a day of a child going on amantadine, they've given it to their kiddo in the morning before they go to ABA therapy. That's applied behavioral analysis for autism. And the therapist said, so and so had a great day today. They were much more attentive, they were a little more focused. And the parents are like, oh my gosh, this stuff is like a miracle. So
Awesome.
the right amount, yeah, the right amount, the right time. So just as an aside, so you mentioned a troche. Can you explain to people what a troche is?
A troche is an oral dosage form that you put in the mouth that dissolve the medication, slowly dissolve over about 10, 15 minutes, and you put it between your cheek and your gum. It dissolves the medication through the buccal mucosa, and then that gets into the bloodstream. And we do that a lot for hormones in general, but we can compound any medication. Obviously, we have to look into the formulation and stuff to make sure it is stable into an oral dosage form for them to do. It's not so much chewable, but it dissolves over time.
Okay. And as far as like topical creams and things like that, you have a lipodermal base. Now, what is a lipodermal base? What does that mean?
So PCCA cream, that's one of their bases that they developed a while back. It's called Lipoderm, and you apply it into the skin, and it gets under the skin, goes into the bloodstream, and we use that a lot in pain gel, compounding prescriptions, and then anything that you want it to penetrate under skin, go to the bloodstream. We use that. Now there's other bases that we use for hormones that is tested, by them and developed by them that is specifically for hormones. So we just have to see what kind of drug that we need to make, and then we're going to decide which base fits best, for that particular active
Okay.
ingredient.
Okay. So there's a hormone base, and then you all also have certain we do this evaluation for people who are losing their hair. We call it our alopecia panel. That's like a hair loss panel. And then you're also able to formulate either like an oil base or cleaning base or a conditioner type base where people can rub it into their scalp where they're losing their hair and they're not guessing instead of logging onto Nutrafol and saying I want this, I want that. It's not like everything works for everyone. It's unique, and so having those choices are pretty cool. I know I've called you many a time and said, what do I do about this? What can I use here? That kind of a thing. So I want to thank you, Van, just for the outstanding customer service that Roberds Pharmacy offers to our patients, especially for the families of children with autism and for some of our adults with autism that are still, they're dependent upon the guardianship of their parents. And also for providing just amazing, I don't want to overuse that word. I'll just say high quality transdermal hormone bases, hormone cream bases, just consistently across the board. And your customer service at the pharmacy is so refreshing to me. I mean, many times I'll call and it will ring once or twice. Someone answers the phone. And I just really appreciate that. I wish I could do that at our office. Instead, we have to go through the phone tree because there's not enough people to answer the phones. So I find that just very refreshing.
And
So,
there, there, there's a
oh,
lot
go
of
ahead.
pharmacies out there because of the volume, same volume that we do also. But I had the choice of making it into a voice recording, and they would just dial the options. But I'm like, no, the patient needs to get to us right away. So I decided not to do that and just have a live body just answer the phone. And that's one of the things that PCCA stands out also is that when we call, they pick up the phone without going through those voice recording like the other wholesalers. One of the things that I want to add also, regarding PCCA, you asked earlier, we do work with a few wholesalers. Now, all of those wholesalers are based in the US, and we only selectively pick certain ingredients and bases that we use, and we use all bases from PCCA. But what I like about PCCA or a similar wholesaler is that we make sure that they go through their in-house third-party testing before the powder gets to us. And that's very important because the certificate analysis of these ingredients and bases are super important for us to look at to make sure they pass the potency that they say, they pass the microbial load, and then also certain testing for endotoxin, things like that. Because if they don't do any of those testing, you don't know what you're putting inside your body or on your, for a long time being on these drugs. And all these kids and adults that you're seeing, they do want cleaner products because they're putting inside them. They want to detox. And if you're not reusing the right product, you're putting more toxins in your body. So that's extremely important to us, for our patients. And I appreciate
Yeah.
you as well in your clinic because I see the challenges you're going through every day, helping these autistic children as everybody's body is different. So they're sensitive to different things. And so as you prescribe one thing, you got to customize it to the child. You got to tweak and adjust it according how they respond. And if you don't do it right, they may have side effects. Like you say, that hormesis, that we talked about. Too much is not good, too little is not good. So everybody responds to different things. So you just have to start somewhere and adjust it. And the patients just have to be patient, or the parents just have to be patient. Majority of the time we get lucky and the kids feel better right away, and sometimes they're not. So use our pharmacy as the first, they can call us anytime to ask any questions. And if we have any challenges whatsoever, we'll present the problem to you. But we are here, to advocate for you and the patients.
Yeah. Well, we're exceedingly grateful on a daily basis. And also, as our team of medical providers at the office, the freedom to call and ask you or Mary or some of the other pharmacists questions. It's so very helpful because, there are just these details and things that we just don't know, or that we need you to look in your database to see if there's any interactions or other things. I know patients ask me, can I use this? And I'm so grateful. And I looked it up and I'm like, no, you shouldn't because you're on this blood thinner and this particular supplement that you're reading about on social media thinking, oh yeah, I should use this. It's contraindicated and it could lead to spontaneous bleeding and problems and things in your own body. So that's what you do for us as a pharmacist. And so, all right, the chemistry lab or the symphony of our bodies. So, well, Van, thanks again for helping answer some of these questions and for talking about leucovorin with me, synapsin, and amantadine. and how these particular medications can so uniquely affect the body. And before we go, I just find it so interesting. Many times I have people that come to me and say, well, it's a drug. Don't you want to do things without a drug? And I'm thinking, these are so safe in many ways. It's so much safer than, say, an antibiotic, for example. If you look at what an antibiotic does, yes, it'll kill the infection, but it can disrupt the entire gut microbiome and the long stream effect of that and trying to rebuild the gut microbiome. So, there's a time and a place for everything. And especially when we can drive our medication prescribing with precision. And so thank you for being a part of the team and so very important for educating and reiterating certain things because repetition is the key to learning. And I'm so grateful for Roberts. So thanks again, Van, for being on today.
Yes, ma'am. But thank you so much for having me on.
Right. Well, take care.
Okay.
Thank you.
Talk to you later. Bye
Bye-bye.
bye.
Thanks for joining us at Get to the Root with Hope for Healing. If this episode helped you, follow and share it with someone who needs it. And leave a review. It helps others find us too. For a free consultation, visit our website at gettotheroot.com with the number 2 and schedule a welcome call. We'll see you soon.